Andrea, on your YouTube channel, you have this phrase that really caught my eye. And I think it's a new one you've just recently added. And you say integrated womanhood and metabolic health. That kind of suggests to me that we cannot talk about women's health without talking about metabolic health.
That's right.
That's right. A little bit more.
It's something, yeah, it's something. Thank you so much for having me, by the way. And it's been a lot of fun chatting with you and meeting you over the last couple of years. And of course, my favorite, Dr. Stanton. It's just, I feel like there's no contest. I don't know why I'm even here because she's just so knowledgeable and skilled. But the honor is mine to be here. Integrated womanhood and metabolic health, to me, just encompasses all of the things that we need to keep in mind to have fulfilling lifestyle as women. And I think we can't talk about women's health and wellness as it relates to gynecologic disease without talking about our metabolism. And I'm not talking about the calories in, calories out model. I'm not talking about exercise necessarily and burning fat and calories. And I'm talking about how metabolism and our favorite hormone, insulin, and how that really relates to gynecologic disease. And so how really as women, and I hate saying this, but for better or for worse, among all of us professional women, we were made to have babies. And if we our biology is going to protect us so that we don't have babies at a time that's not right for us. And so insulin is intimately related to that. And if our insulin levels are high for whatever reason at all, our inflammatory levels are high, our body is going to keep us from having a baby at a time that's not right. And so then it's going to protect us by stopping our menstrual cycle. And so really that's kind of my North Star. Inflammation also with damaging the blood vessels that create pregnancy, that create ovulation, those things. And then of course, as we gain and advance and mature in our womanhood, there's different things that come up from that. But you cannot not talk about womanhood without talking about metabolic health.
You mentioned insulin. Of course, that's one of my favorite hormones, a hormone of interest to me because of my type 1 diabetes. But I remember with Dr. Stanton, when we were talking about migraines, I remember the role of insulin, or insulin resistance rather, when it comes to women's health. So migraine is also partly a metabolic health issue, right?
It is very much so, because it is, okay, so we have to separate two things here. Actually more than two things. So one is of course you have to have a genetic predisposition to getting type 2 diabetes or type 1 diabetes or any kind of metabolic disease. And then how the metabolic disease presents itself can change depending upon your genetic makeup. So some people may end up with Alzheimer's disease. Some people may be getting multiple sclerosis or something similar, whereas another person may get type 2 diabetes. So this is something that's very strongly, we all have metabolic disease sensitivity, but what way it will present is genetic. And so in terms of migraine, it is genetic on its own. And the genetic presentation of migraine, the cause of migraine is a different brain, which is intolerant to carbohydrates. So this is how it connects to metabolic health, is that if we eat too much carbohydrates, then our brain isn't going to be able to work too well, because because I'm a migraine sufferer, so I don't mean you two who aren't, but those of us who are, our brains, we are predisposed to have that presentation of a metabolic disease that we end up with migraine. So if we resolve the metabolic disease, then we resolve the migraine as well. And many times people tell me, but I have different migraines. That you can't have different migraine. It's like you can't say that you have a different type 2 diabetes. It's like the cause is always the same for all diseases. The presentation may be different. You may have slightly different symptoms, but the cause of every single one disease is going to be always the same, but your response to it may differ. And so when we're talking about the metabolic disease, yeah, for me, it's a presentation with migraine, may also present as type 2 diabetes in other forms, but maybe it won't present to me as PCOS, with my sexual organs, or gestational diabetes. I mean, it's just different presentations.
Of course, there are unfortunate women who have all these, or a number of these presentations.
Right.
So that must be a tough one. When I complain about one thing or another, I always think of women who are presenting with not just migraines, insulin resistance, on top of type 1 diabetes, because my community, the people that I associate with are mostly type 1 diabetics. So suddenly they have now migraines, and they're perimenopausal as well. So they're very similar. So they're my age, and they're perimenopausal symptoms, which on their own can be quite unbearable. And I know that they were for me.